Hi, I'm Riku Paryoim, Faculty of Nursing, Assam Downtown University. Today I'll be talking on the topic steam inhalation. Steam inhalation, it is a breathing warm and moist air which is produced by a vaporizer into the mucous membranes and respiratory tract, which is called as a steam or moist inhalation. So it can be used either in the form of only plain water, only in the form of water or medication. Purpose to relieve the inflammation and congestion of mucous membrane, to soften thick and tenacious mucus which help in expulsion from respiratory tract, to provide heat and moisture, and to prevent the dryness of mucous membrane, to help in absorption of oxygen, to relieve in congestion of the larynx and the bronchi, and to provide antiseptic act in the respiratory tract by using either in the form of medication, either by using menthol or Vicks. Types of steam inhalation can be plain or medicated. Indication: it is indicated to use steam inhalation in the case of sinusitis, edema of the larynx, thick mucus in the chest, acute bronchitis, whooping cough, after tracheostomy, or spasm of the mucous membrane of the larynx. Contraindication: it is contraindicated in a case of a very young and very old patient, patients with high fever, and patients with severe headache. Methods for giving steam inhalation: it can be given in different methods, either by electric steam inhaler, by jug method, steam tent, and Nelson inhaler. So it depends on the availability of the methods. You can use either of the methods. Articles required: a tray containing a Nelson inhaler using as a vaporizer. As I'm going to explain the procedure which is by this Nelson inhaler method. So a bowl with tissue paper or gauze piece, that is to wipe the secretion, a sputum mug to cuff and to collect the secretion, a spot of inhaler which is plugged with cotton swab to prevent steam loss, mouthpiece which is wrapped with gauze piece, ounce glass in case we are going to add medication, towel to cover the inhaler, and a bowl to keep the inhaler to prevent from burn, kettle with boiling water, extra blanket or sheet to cover the patient to prevent loss of steam, a cardiac table to keep a comfortable position to the patient. General instruction: we should always remember the danger which involves of burning or scalding the patient either with the steam or with the water that is coming out from the inhaler. So when the jug or kettle is used, we need to fill up only 2/3 with boiling water to prevent burning injury to the patient. So if the inhaler is filled to the brim, there is a possibility of drawing the water into the mouth and scalding the patient. Now the water should always remain just below the spot. If the spot is filled with water, it will not act as an air inlet, so the patient will not get warm air. So after, remember the danger of fire. If a stove is used with kettle to generate steam continuously, as in case of steam tent, the blanket used may fall on the stove and catch fire. So we have to be very careful of this accident. So we need to have the water in a jug method to at a moderate temperature. The temperature is maintained between 120 to 160 Fahrenheit, because you know why? If it is too cold, we need to maintain the temperature between this degree, because if it is too cold, it will not generate the steam. But if it is too hot, it will cause injury to the patient. So we should keep the patient warm and prevent drop before, during and after the inhalation. So during the treatment, remember that the blood vessels of the patient and mucous membranes are dilated and the patient is easily exposed to chill when they exposed to drop. So this predisposes him to more severe and prolonged attack of inflammation and congestion. So therefore the patient should not go in a cold atmosphere for several hours after the treatment. Instead, the patient should remain on the bed for several hours after inhalation. When the volatile drugs is used, for example like Vicks or menthol, we need to warm the patient to keep the eyes closed to prevent the drugs irritating the conjunctiva. Watch the patient closely throughout the procedure for any side effects. Provide a calling bell near to the patient bedside in case the patient in need of the to call the nurses if necessary. So when giving the inhalation by tub method, keep the spot away from the patient. This is a precaution to prevent the injury or scalding to the patient. Place a sputum cup in the reach of the patient to spit the sputum cup that is coughed up during the inhalation. So as it causes the loosen of the mucus, so that there's a chances that the patient might cough out of the secretion. So we need to explain the procedure to the patient before preparing of the inhalation, so that no time is lost to start the inhalation, because once the inhaler is boiling the water, so it need to be taken to the bedside of the patient. Procedure. The procedure for a Nelson inhaler method. The inhaler has a glass mouthpiece which is passing through the cork of the inhaler and an air inlet at the side. So we need to prepare the patient and get his cooperation. Protect him from cold. Have him comfortably seated with the bed table in front of him. We need to explain to the patient properly regarding the injury of, if we are not maintaining at the if we are not the injury of had injury of causing any injury due to the if we are not taking the stimulation in the correct manners. So warm the patient warm the inhaler with a little hot water and pour the water out. Pour the boiling water just below the air inlet. Now add the drug orders in case if the patient is advised to take steam inhalation with the drugs orders, so the patient need to add the drugs. But in case if the patient needs to take only plain inhalation, so he don't need to add any drugs. So next we need to cook the inhaler. Turn the mouthpiece away from the air inlet. Wrap the inhaler in flannel or a towel and place it in a small tray or basin. Take it to the bedside together with a towel and gauze piece. Wrap the piece of gauze around the mouthpiece of the inhaler. The next we need to place the inhaler in front of the patient and ask him to keep his mouth in the mouthpiece and breathe through the mouthpiece to receive the steam, and breathe out, removing his lip from the mouthpiece. Now we need to continue the treatment for at least 15 to 20 minutes. Wipe the patient's face and keep him warm in the same room for at least 1 hour. Then wash the mouthpiece and boil it. Wash the inhaler and replace all the articles. Record the procedure and effect on the patient. Okay, that's all about the steam inhalation.